So good morning. I am Dr. Janet DeMille, Medical Officer of Health of the Thunder Bay District Health Unit. I want to give you an update, first of what's happening here in the Thunder Bay District Health Unit area, because we have seen an increase in number of cases over the last week. And I want to provide you information about that. I want to touch on the information that was provided yesterday provincially. And I want to end by reminding you and providing recommendations on what everyone can do here to reduce the impact of this virus in the Thunder Bay District Health Unit and more broadly in Northwestern Ontario. So I will start off with our situation here in the Thunder Bay District Health Unit. So we've now identified 12 cases of COVID-19 in this area. The first one was just a little over 1 week ago. 10 of these remain active, 2 have resolved. Not unexpectedly, many of these were travel related, especially from international destinations such as the United States. Others were close contacts, what we would call close contacts, individuals who may be traveling companions or individuals in the same household with close proximity to the individual with COVID-19. And it is not surprising that some of those are also positive. We have tested a number of other people related to the cases of COVID-19, individuals who have it, individuals who may have potentially been exposed and had symptoms. And many of these turned out to be negative. They didn't have COVID-19. As I've indicated, none of this is surprising. Travel remains our biggest risk factor. Individuals who have traveled to other countries or other parts of Canada who unknowingly and unintentionally have brought the virus back here. And of course, some spread within families or within a household. That's what we've seen. This is in the setting of the fact that we have done approximately 500 tests that we're aware of. Obviously 12 were positive, 430 have been negative, and currently about 60 are pending. That's one positive thing that we've seen, is that the backlog of testing that was pretty noticeable in the last couple of weeks has now been dealt with. And I believe the turnaround times for tests is also shortening. I want to let you know that 3 out of the 12 are still under significant public health investigation. These 3 cases or individuals with COVID-19 are not quite so straightforward as some of the others, and I want to provide you some additional information about these. These individuals are all in Thunder Bay, and they did not travel. At least they did not travel within the previous 2 weeks prior to the onset of their symptoms. It appears that these individuals acquired the virus in Thunder Bay. For 2 of them, it is likely they got the virus from somebody close to them who did travel. This would not be surprising. Someone travels, comes back home. They themselves may have developed a mild illness of COVID-19 and pass the virus on to others who are close to them. For the 3rd individual, it is possible that it is the same situation, that they were in close contact with somebody who had traveled. However, it may not be this, and we are still investigating these 3 situations. What this means, though, is that there are people who have COVID-19 in this area that aren't being identified. Perhaps they had fairly mild illness. Maybe they didn't think much of it. But those individuals can be passing the virus on to others without even knowing it. These cases could also be indicative that there is community spread in this area, especially that 3rd case that I mentioned, where we have not yet identified where that person got the virus. It is hard to make clear conclusions about community spread based on a small number of people. However, with the possibility that not all people, and in fact the likelihood that not all people with COVID-19 are being identified, it is quite possible that there is community spread here, at least in the Thunder Bay area. I would say, though, that this is likely at low levels. We may know more over the next week or coming weeks as we follow up on further cases of COVID-19 that I am expecting we will see. We need to act like there is community spread here, and I'm going to come back to this in a few minutes. I want to now touch on the information released by the province yesterday in regards to modeling and predicting what the future may hold and what it might mean for us. I'm going to start off by noting that there's a lot of caveats and challenges to modeling and assumptions that need to be made. Projecting the short term into the future may be a bit more accurate, may be more accurate than projecting several months into the future. So yesterday they did provide some data around projections that what we might see in Ontario by April 30th. They also provided some projections over the course of the pandemic. With this virus, when this virus spreads, one person typically passes it on average, to 2 other people. Those 2 people pass it on to 2 other people. That leads to exponential spread of the virus in the community. So I'm going to provide a couple of key messages based on the information provided yesterday. So the total number of cases in Ontario, if we just maintained the current measures that are in place or that were in place this week or earlier this week, the projection is that there would be 80,000 cases in Ontario by April 30th. This has been significant, this number was significantly reduced from the total number that would have been anticipated if major public health measures were not in place. So the public health measures that are in place already have already resulted in a lower number. However, this number, 80,000 cases in Ontario, can be further reduced by other public health measures. And the prediction with these is around 12 to 13,000 cases in Ontario. Some announcements were made in recent days around what those additional public health measures will be. I also want to point out that the number of deaths in Ontario is fairly significant. By April 30th, and it would be anticipated in the current scenario that there would be 1,600 deaths in Ontario. However, with additional public health measures, that number would be much lower. And what they said yesterday was 200 deaths. And as I noted, some of those additional public health measures at the provincial level were announced yesterday or in the past few days. I want to take this opportunity to sort of talk about how this might apply to Northwestern Ontario. So over the next month, that is until April 30th, we are going to see a significant increase in the number of cases here. We will likely get more concrete evidence of community spread in Thunder Bay and in other communities. And we will also see deaths related to COVID-19 in this area. These next few weeks are going to be uncomfortable as we watch this happen. However, I do want to reassure you that there are very significant public health measures already in place. these are benefiting us already. The closure of schools, restaurants, bars, gyms, other services, the closure of non-essential businesses are some of those examples. In fact, we here in northwestern Ontario may benefit from those measures more than those in southern Ontario because they were implemented very early here. And early implementation of those kinds of measures at a population or community level can significantly help. In addition, other measures will benefit us. Some, as I noted, were announced yesterday. These include, or in the last couple of days. These include the extension of school closures, further closures of non-essential businesses, closures of parks and outdoor recreational amenities, the recommendation for self-isolation for individuals over 70, and some new information we received yesterday of enhanced capacity for contact tracing, which will allow us in public health to better contain the virus. All these measures are going to help us here in northwestern Ontario. So the province is doing things. We've seen municipalities and townships in our area doing things. First Nations communities are doing things. All of these are going to impact or mitigate the impact. All of these things are going to reduce the spread. All of these things are going to flatten the curve here in northwestern Ontario. I do want to remind everybody, though, of all the things that we as individuals and families can do to support all those other measures. This is crunch time. We must all do this well, and we must all do this now. I will start off by talking about travel. If you are returning or have returned from international travel, you must self-isolate at home for 14 days. This is under a quarantine order under the Quarantine Act, the Federal Quarantine Act. If you are returning to northwestern Ontario from other parts of Canada or other parts of Ontario, you need to self-isolate at home for 14 days as well. If you self-isolate at home, if you have inadvertently acquired COVID-19 and you self-isolate at home, you prevent the spread of that virus into the community. I also want to strongly recommend that you do not travel for non-essential reasons between communities in northwestern Ontario. You may unknowingly be spreading the virus. So if you are in Thunder Bay, please stay put in Thunder Bay. If you are in Greenstone, stay in Greenstone, unless there's essential reasons for you to travel. I want to note that there is a long weekend coming up. Please don't travel. This is not the time to do it. Please don't gather together with family and friends that you might have in a normal year done. Get together through electronic means or consider deferring your gathering until a time when this is over. I want to encourage all people to stay at home as much as possible. Avoid non-essential trips into your community. Don't gather together with other people. Use electronic means for that kind of connection. When you do go out, like if you're going to the grocery store, please take all appropriate precautions to reduce the spread of the virus in those settings. Wash your hands both before and after your trip. Stay 2 meters away from all other people. Use the tap function to pay for your groceries rather than exchanging cash. Avoid going outside of your home at all if you are sick. Remember also all those personal measures that we can take many times a day that will reduce the risk of spreading the virus to others or of ourselves acquiring the virus. Wash your hands frequently and for at least 20 seconds. Cough or sneeze into your sleeve. Maintain your distance from other people. Clean and disinfect surfaces, especially those high-touch surfaces like doorknobs, light switches, and keyboards, for example. I want to end by acknowledging that these are indeed challenging times. These are uncertain times. These are uncomfortable times. This is going to go on longer than any one of us want it to. However, it will end. While it's hard to predict the exact timing, at some point we will see things start to get better. That could be in May. And we need to hold on. We need to do right now all the things we could do to reduce the spread of this virus here, so that we can see as early as possible that improvement happening and us all being able to return to normal. That will take time, but that will happen. And I want to encourage you to do all that it takes to make those decisions, to do all that it takes to reduce the impact here in Thunder Bay District, and broader in Northwestern Ontario. So thank you very much, and please stay safe.